Assalamu alaikum. Good morning. Thank you, everybody, for coming to our presidential session. The topic today for our session, the shaping of a future global oncology through regional collaboration. I would like to invite our panelists. We start with Dr. Faheem, from President of FARO and Pakistani Association Oncology. Please, Dr. Faheem. I would like also call Dr. Banu from Turkish Association for Radiation Oncology. He's here. And also like to call Dr. Khalid Balaraj. He's an oncology service leader in United Emirates. And also would like to call Dr. Mouza Al-Ameri. She is President of EORA. Thank you. And Dr. Abdulrahman bin Sumaida, please. He's the President of ESRO. Thanks for coming. So today we are joined by leaders of professional societies from around the region who represent the clinical oncology, the radiation oncology, and the multidisciplinary cancer care. Each of you leads a major initiatives aimed at strengthening clinical care, improving education and training, and driving research and policy change in your national context. The Lancet of Oncology series on cancer control in the Middle East highlight the resistance barrier of equitable access, quality care, and workforce capacity, evidence generation, and system integration. Those issues that require both local leadership and cross-regional collaboration. We will explore your society, how they can respond to those channels. So we'll start the session by a common question to all of you. The question said, no, here we go back, sorry. This is different. Anyway, the common question said, I would like each of you to say one brief sentences about your vision for regional oncology collaboration over the next decade, please in one line because of the sake of time. We'll start, Dr. Faheem.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and very good morning. Thank you very much. I think if we look into the current situation or current scenario, we are living in a resource limiting countries. And the Asia Pacific region is a region which carries more than 50% of the population of the world. And about 34 trillion US dollar is the economy. But on the other hand, what we see is the deprivation of cancer treatment to all that should have been our responsibility to provide them at their doorsteps. So regarding the regional collaboration, I have wrote certain points here. Regional collaboration is the key to improve cancer outcome across Asia and now from outside Southeast Asia to AMSTRO region as well. And I congratulate Dr. Nadeem and his team who have taken this initiative for joining both Asia and Middle East, where geography is more or less similar and the cancer is most of the time is very common. The biology is common. So how we can improve it? And we can follow the example of Federation of Asian Organization for Radiation Oncology, which is FARO. The FARO is a organization in which 15 countries are involved, including all the rich countries of this region and the poorest countries as well. And what we are doing is in collaboration that can be applicable to this AMSTRO region as well, is building and sharing a data, which is cancer registry and surveillance. That is the key for early detection, early treatment start, and the availability of all resources to all, because cancer has no boundaries, no religion, and no borders. So once the borders are not there, everybody's right is to get the treatment on time at early stage. Once you are developing a cancer registry, you can harmonize standards, guidelines, and training, pooling resources, equipment, drug and procurement, which is a bit difficult task, but you can do it. And you can have joint clinical research and trials, cross-border training, visiting a specialist program, and telemedicine. And above all, empowerment of young oncologists. And this should be your minimum thing which you have to do regarding this. Thank you.
Okay. Mr. Balaraj?
Well, first of all, I'd like to thank the organization for this meeting. It's a great opportunity for me to be in this great event. AMSTRO, the Asia and Middle East Society for Therapeutic Radiation and Oncology, is a hope for us for the future. I think all of us as oncologists keen to attend one of the annual meetings, whether ASCO or ASTRO or ISMO, name it, to have our own, society in the region that deal with our own culture and the challenges that we have with resources is a great opportunity to improve the it will be more creative for equitable, efficient and effective care to have a care of cancer patient in our landscape area. I think it will improve the outcome on the patients and expand the hope of our patients when they get cancer to survive. So there are a lot of area of collaboration, and I think the best one is to unify the cancer care among all the regions for all the challenges that we have, how to overcome it. We will get more experience from each other, how to overcome these challenges in order to improve the cancer care.
Good morning. Thank you so much for the invitation. The AMSTRO will give us a better chance, at least as Dr. Khalid said, to collaborate and enhance our oncology care. And maybe we'll have a database where we can refer patients to every time they travel back home or they travel abroad, and we have someone to like a reference person in the oncology and the place our patients will go. Because this region has a lot of international patients who come get treated, but the follow-up will be lost if we don't see the patients and they go back home. That's whether Pakistan, India, or anywhere in the Middle East. So if we have a reference person or a reference association, oncology association, that would be a great collaboration among us. And this, to be achieved, will be a great job.
As you know, ESRO and FARO and other societies, like the Pakistani societies, all are fragmented. And in UAE, we have a different patient from different background. About 80% of our patients are extrapat. So AMSTRO really is the home or the umbrella that unifying us to communicate to our colleagues in the Middle East, in the Asia and other regions, because end of the day, cancer is a genetic disease. So different background, different cultures, different genetics plays an important role. So I think AMSTRO is offering us a lot of things to how to communicate among each other and to exchange experiences through all the centers. Thank you.
Thank you. Thank you. Now, we find out that to run such a panel, we need the help of a journalist. So we have Mr. Abdullah with us today. Here. He's from Sharga TV. He's here. Yeah. So we need the help of journalists here. So welcome you to come to co-share the session with me. So we will start now by a specific question to each member. Okay, and we'll post the question on the top here. And Abdullah, can come here, Abdullah? You will start the question. Yes, sir. Okay, so we start. Dr. Faheem, this is the first question to you. Name one major obstacle to cancer care in your region and suggest a solution to address this problem.
Thank you very much. I think the point which I am going to discuss is not only in my region, but it is in the entire world. That is the late diagnosis of the cancer patient, which is more in our area. There is more than 80% of the patients, they are diagnosed with locally advanced cancer. And why this is happening? So I want to discuss few things regarding this. Why in our region, in Southeast Asia, particularly I will talking about Pakistan to begin with. We are unable to reach the source where we can get the diagnosis and screening. That is the main issue, because more than 50% of the population is in the villages and the urban areas are different. All cancer treatment facilities, screening and everything is available in bigger areas. And there are social stigmas. And social stigma itself is an issue, which leads to late diagnosis. Once the patient develops stage 4 cancer, then it goes to the major cities for the diagnosis. There are alternative treatment modalities available. They don't go to the doctor. They will go to the mosque first, then they will go to Hakim, homeopath, and alternative, the Greek medicines. You can, and this is everywhere. So question is, why this is happening? Diagnosis and equipment, I told you. Number 2, financial constraint. That is the biggest issue which we face in my country. And this the same thing is happening in FARO region. And because FARO is the design for this purpose, to how to overcome these issues of this region of Southeast Asia. So the diagnosis is late. Why? Due to financial constraint, patients are unable to go to bigger cities for their diagnosis. Low awareness and health policies are lacking. That is another issue. Health policies are not there, particularly as far as the cancer treatment is concerned or cancer diagnosis is concerned. Lack of public knowledge. How we can overcome this? We are lucky to have an established system in Pakistan now. Pakistan Society of Clinical Oncology is doing a lot of things. It is a part of FARO. And what we have designed in FARO, it can be implemented on any society which is dealing with region. Like AMSTRO, what we are doing in that, and I'm grateful May is here, and IAE is doing a wonderful job as far as these low middle income countries are concerned. So FARO is a part of IRON as well, which is the International Radiation Oncology Network, in which the ASTRO, ESRO, the New Zealand, Australia, the Latin American, and the FARO are the members. So this is for the knowledge sharing. This is for the technology share. It is all there. So how we can overcome this issue of late diagnosis and deprivation of treatment? We need equity for all. Patient is a patient, needs to be respected, whether it belongs to Bangladesh or it belongs to Pakistan or it belongs to United States. So for this purpose, what the model which we are doing in Pakistan, we have introduced screening clinics, mobile units, even we are offering in our Pakistan Atomic Energy Commission's hospital. And those mobile units, they go to the peripheral areas, villages and where they go and give the awareness talks. Even that they have got a big bus in which they are having the ultrasound machine, and the doctor and histopathologist is there for the fine needle aspiration and even the diagnosis they can get. Once the FNAC shows something wrong, the patient is being referred to big hospitals. So there are 39 cancer facilities available in Pakistan where we are offering the radiation, but it is not enough. Only those can get the radiation who can go to the bigger cities, because in lower areas, no radiation is available. Number two, which has to be done by the policymakers, and it is the investment in healthcare sector, particularly the oncology. So you can do it by increasing the diagnostic facilities like imaging and the pathology labs and cancer treatment centers. The third important issue which we are facing in our region is the brain drain. We train people, young oncologists, we train them, send them abroad to get a better technology awareness, and later they leave the place and they go somewhere else. This is the biggest issue which we are seeing. But now the College of Physicians and Surgeons of Pakistan has started a brain gain retaining system as well. So they send themselves to abroad, and then they have to report back to the country for the survey. But still, there's a lot of gap. Number three, the most important thing is the financial barrier. The radiation equipment, like Professor Armstrong was talking about the radiation. So regarding the protons, only 3 proton equipments are available in Pakistan, out of reach, very expensive. Patient cannot afford them. IMRTs, VMAT, the SBRTs, they are available in bigger areas, and we are providing those treatment to them, but it is not for all. Equity is not there. In all the FARO regions, like Japan, China, Singapore, they have got everything. In India, a few centers. In Pakistan, only 5 centers are having which the MR Linux and the protons, but the basic radiation equipment is there. But there is a lack of lot of improvement is required regarding the treatment is concerned as far as we people are concerned. So I will take a minute. I'm not taking too much, Khalid. In FARO, what model we are following, you can adopt that. In FARO, we have 5 committees. There is an education committee, there is a research committee, there is a public awareness committee, there is a scientific committee, and another committee which is going to be launched very soon. So what we are doing, we have engaged different experts from different countries. There is a team. As far as the research committee is concerned, Umera is sitting here, she is the lead. And we have published so far so many papers involving all the 15 countries of Southeast Asia. Regarding leadership program, every year we have a batch of the young oncologists. We train them like a leader. So they are a continuous source of training, providing training to the other batch. Similarly, public awareness for cancer awareness and other things. So like this, I think this model can be followed. Thank you very much. I'm sorry I have taken your time.
No, thank you. Thank you, Dr. Faheem. Thank you. No, so the second question is to Dr. Khalid Balaraj. From your experience in UAE, how does building comprehensive cancer center contribute to improving the quality of care for patients?
Before 10 years, in United Arab Emirates, the cancer care was fragmented. And then now we have a proper set of comprehensive cancer care in Tawam. Let me define what we meant by comprehensive cancer care center. In the past, we care about only the modality of treatment, whether it's through chemotherapy or surgery or radiation therapy. But when we talk about comprehensive cancer center, we should talk about it in 3 levels. The first level is pre-diagnosis, whether to improve prevention and also screening. Then we deal with the second phase, which is the actual treatment or investigation. Investigation, we should have top-notch of investigation tools, and also the modality of treatment, whether it's surgery or chemotherapy or radiation therapy or immunotherapy. We should have the state-of-art machine. And this is what we meant by having all these in the comprehensive cancer center. Also, paramedics or supportive care. through nutrition or physical rehabilitation or mental health that play a important role in cancer care. Then phase 3, which is the after treatment, whether through end of life care, through hospice or home care, and then survivorships or survivor clinic. I can tell you, 10 years back, our rule was just to see the patient. The minute you get diagnosed in UAE, the patient will come and ask for medical report to go abroad.
Yeah, right.
And this is history now. Alhamdulillah, we gained the trust of a lot of population in the UAE and the healthcare system, not only because of having only comprehensive cancer center, but also thanks to COVID period, 3 years of period where the patient was unable to travel abroad. And we treated them, they get the experience, and it improved a lot. So I think to have a good quality of care, we should have a comprehensive cancer center where there is not only delivering the treatment to the patient, but taking care about education, taking care about research, how to make sure that we play an important role in the awareness for the patient about cancer. The culture there in Europe or in America where we train is completely different. And there, the relative or the patient will ask you not to tell the relative about my diagnosis. In our culture, it's opposite. Before seeing the patient, the relative will come to you, please don't tell the patient that he got this type of cancer. So I think we have a lot of effort to do to educate the people how to care about cancer through these comprehensive cancers.
Thank you. Thank you, Dr. Khalid. So, second question to Dr. Mouza. How is EORA integrate multidisciplinary approach to improve both cancer outcomes and survivorship quality in your region? And what are the biggest barrier your society is targeting?
Dear doctor, this is a huge question.
Yeah.
Now we can talk
for you, special for you.
Yeah, but what I'm going to do is just
Okay.
emphasize it. So the EORA is the Emirates Oncology Radiation Therapy Association. So as Dr. Khalid said, we work at the same center. We see a lot of patients, they're fragmented care. Patients come to me for surgery, they go somewhere else for oncology treatment, and then they come back to us for radiation. And this idea of EORA was not an idea of one-day experience. This is a cumulative experience of so many years working in the cancer center and the oncology society. So a lot of us came back from Europe or America or North America after studies and postgraduates, and we were thinking, how come we do not have one integrated system where we can all rely on and go back to in case we have questions? Why is it that I have the NCCN guidelines and another center gets another guidelines? As we discussed previously with Dr. Khalid, I come from a German background and my education totally German. So I have another guidelines. Dr. Khalid has another guidelines. Dr. Abdulrahman has also another guidelines. So what we did, and we thought about, let's just collect ourselves and our abilities and our efforts and this care we do care about to these patients and put it in one association. So this association is not only for oncology or radiation therapists, it's for anyone working in the oncology department. I'm a surgeon, but most of my patients are oncology patients, breast cancer. And we have physiotherapists, we have oncology dietitian, we have people who do also physiology and a lot of other things. So we established this association, and we found that a lot of colleagues really are very much interested in joining the association to have one base. So as to mention that most of our patients, like 75% of our patients are foreigners. So what they do, they go back home sometimes, and sometimes we lose follow-up. So there is no survivorship. program for them. So what we thought about a survivorship program, and we established the guidelines for survivorship program, but still we lack a lot of patients sticking to their survivorship programs. I think after so many years working in the oncology center, we have improved our follow-up for patients in a way that we can say that we do have a lot of patients base where we can go for research. The biggest barrier in the society is, as Dr. Faheem said, patients come very late. They're afraid, they're ashamed, they're scared, or they don't know. Or they think if they find that they have a disease, they might just die of it. You know, just ignore whatever I have. So if I ignore it, it will go away. No, cancer does not go away so easily. So in the UAE, we have a very good screening program, but we don't have the audience for the screening program.
Okay, great. Thanks very much. Now, may I ask Mr. Abdullah to lead the second question? This is.
Yes. So the last question will be for Dr. Abdulrahman bin Sumaida. Doctor, my question is regarding the Emeri Society of Radiation Oncology. How do you see, Doctor, your relationship with policymakers? How are you engaging with them in terms of elevating the quality in assurance of oncology? And what policies, Doctor, you see that must be shifted within the 5 or 10 years from now?
Thank you. As you know, ESRO is the Emeri Radiation Oncology Society. Is the birthday was almost 2 days ago, almost 1 year we completed. And the whole idea is about to talk with the policymakers, to collaborate with them to address the issues and our concerns. The only way to do that is through the society. So we are promoting as well and advocating the global standards. For example, small example, a few days back, we promote how to use the laws of radiotherapy for benign conditions such as arthritis. So there was obstacles from insurance, from Department of Health, but thanks to God, we have a great meeting with them, and we are running a pilot of study regarding this issue. And by end of the year, they will approve everything. And this can happen only through the ESRO to attach and align with the policymakers.
Sure. Thank you so much, Doctor. We will have a last common question to end the session with, and this common question will pass upon you, doctors, and we'll have a brief 30 seconds answer, not 30 minutes, or even 1 minute answer. The common question is, if there is one key area in terms of cancer care that needs to attention, that needs change, well, what will that area be? I'll start with you, Dr. Khalid.
I think we need to promote the awareness of cancer of our culture or society. I think this is the most important one. I'll leave the rest for my colleagues to comment on.
I think once you are having early diagnosis after the awareness campaign, you have succeeded everything. So that can lead to cancer registry and to devise the strategies for your future planning.
I think, I know Abu Dhabi is doing this. I'll make screening obligatory. Screening for cancer as an obligatory test for renewal of whatever. But this is already practiced in Abu Dhabi. Do they do it? Not always, but it's an obligatory process. I hope it will be an obligatory process in the whole UAE.
Hopefully. Thank you, Doctor.
Firstly, to have equal access to all patients from any place in the country.
I'll stress only one point. I totally agree with Professor Armstrong for what he said about radiation therapy. I think we need to know as radiation oncologists how to sell our product. I mean, the medical oncologists, they do it through the companies, but we need to find a way how to sell our product.
Thank you, Doctor.
One thing we can add in it as is the cross-border collaboration. Like we are sitting in AMSTRO as a representative of Pakistan Society of Clinical Oncology and FARO. I think we can regionally collaborate with each other for better results.
Okay, so thanks everybody for a nice meeting. And for the sake of time, we have to finish now. No time for a question. Thank you very much.
Thank you so much. Big round of applause for Dr.
So, we'll call for a second.